Good day to you all. I'll be showing you a myriad presentation of interstitial ectopic pregnancy. This is a 40 years lady conceived after 10 years of infertility by IVF, referred for a routine viability scan. And this transvaginal video in the transverse view of the uterus shows you the endometrial cavity is empty and there is excentric implantation of the gestational sac seen at the junction of the interstitial segment of the left fallopian tube and the uterine myometrium. Note, you also see a tiny little yolk sac within it. And the gestational sac was more than 1 centimeters away from the endometrial cavity. In addition, you could see the vascularity around the trophoblastic tissue, and there was hardly any myometrium seen around the gestational sac. Going further, we also like to highlight a very important sign, interstitial line sign, which is seen as an echogenic line extending from the superior lateral margin of the endometrial cavity here, which was traversing the myometrium and reaching right up to the center of the ectopic pregnancy, which has been very well seen on a omni view. And this has a high sensitivity and a specificity for the diagnosis of ectopic pregnancy. The lady underwent medical management, and these are the pictures, the videos showing you post-methotrexate heterogeneous mass, which was replacing the sac. This is another patient, which is about 28 years old, who presented with prior history of ectopic with a positive pregnancy test and now has lower abdominal pain. Obviously, she shows us a classical presence of a large gestational sac with a non-viable fetal pole, which was seen in the left corner of the uterus and was outpouching, producing an outpouching sign of the myometrium. It was bulging across the myometrium, and that is what is called a bulging sign of a large interstitial ectopic, which has been very well seen on a 3D reformatted imaging, showing you not only the bulging sign, but also there is no communication between the endometrial cavity and the large gestational sac. She underwent left-sided self-injectomy. And showing you another case of heterotopic interstitial pregnancy where there were coexistence. This lady was 29 years old, gravid at 8 weeks, amenorrhea presented with spotting and pain in the lower abdomen. Beta HCG was 48,000. And if you could see carefully, you can see the intrauterine gestational sac as well as the presence of an interstitial pregnancy. So they were coexistent, interstitial as well as the intrauterine, and there was a subchorionic hemorrhage as well. And this, she underwent a medical management, and you can see this on a 3D image showing you the presence of an interstitial ectopic as well as an intrauterine pregnancy was medically managed. To summarize, history is crucial. Talk to the patient. TBS plays a major role, complemented by a transabdominal scan, which gives you a global overview. Empty uterus and positive pregnancy test should alert all the locations of ectopic pregnancy. Early diagnosis and treatments of patients is extremely important to decrease morbidity and mortality, and preservation of uterus and subsequent fertility is important. Thank you.